Thank you very much indeed, Pam, and good afternoon. I would say it's lovely to see you all, but I can't see many of you, but it is lovely to spend the next hour and a bit with you this afternoon as well. And hang on in there, everyone. End of term is in sight, so please do hang on in there. You're still doing an absolutely amazing job. And it is getting hard at the moment, really. I know probably you want to hear from Mike more than me and Adrian this afternoon, but shall I start on the news about the Christmas period that Nick has very helpfully put in the chat? No doubt you will get, well, we will send it out in comms first thing tomorrow anyway, so if you don't have much of a chance to digest it properly, we'll ping it out to you, and you'll have that tomorrow morning. And then I'll say a little bit about Basildon. I think I'll preempt that if that's okay. Then I'll hand over, Mike, Adrian, I'll hand over to you to maybe update on just what's happening with the virus and testing. And then depending on what's in the chat box in terms of questions, then we'll just do the usual with regard to the questions that everybody's got. So if that sounds like a plan, I shall start, everyone. So literally within the last, well, it hit my inbox about 15 minutes ago. I don't know when it exactly came in. The Department for Education have now issued end of term planning, which we were expecting today, tomorrow, which I said in my comms yesterday. What the main tenet, and I'm digesting it as quickly as I'm reading it, is you'll be aware that contact tracing is from the onset of symptoms, not from the positive test. So the issue being around the role that schools play in contact tracing if a pupil or a member of staff displays symptoms during the weekend after the term has finished. It may then take a couple of days for the positive test to come through, which will impact on contact tracing, but will come back to the school with regard to the last couple of days of term. So that's the juggling act for everyone. What the DfE have issued this afternoon is permission, I suppose, to take an inset day on Friday the 18th of December. And then they are suggesting that, I don't actually quite fully understand the next sentence, if I'm honest with you. I think it's sort of assuming you'll have an inset day on the 4th and then you would purely swap the 2 inset days over. But if you haven't, then obviously the one thing you'll need to do is work out then which inset day you swap for the one that you want to take on the 18th of December. And they are, giving you permission to do that. They're then basically saying that there may be, you may be asked to get involved in contact tracing up to Wednesday, the 23rd of December, but they're not expecting contact tracing to continue beyond Wednesday, the 23rd of December, if the last day of teaching is Thursday, the 17th of December. So it is trying to mitigate and minimise the encroachment on that first week of the holidays with regard to that. So that has come through, and we need to very quickly, or Alex will talk very quickly to the contact tracing team, because the one thing I also want to help with is also how you can be as prepared as you possibly can before the end of term to ensure that the administration around contact tracing is as little as it possibly can be. So it is something about, and you're already doing this anyway, but something about just being very tight on your organisation of making sure that your attendance is absolutely accurately recorded, your seating plans, your staff movements, and so on and so forth, so that should you have a positive test that needs to be contact traced back now to the Thursday, the 17th, potentially Wednesday, the 16th, then you are in receipt of being able to respond, working with the test and trace team. So we'll try and help and support as much as we possibly can. What that doesn't do, and I would like a temperature check from you this afternoon, if I may. What that doesn't do is help you plan for the start of the term in January. And I know that there are also discussions that have been had around a potential increase in positive cases because of the easing of the restrictions over the Christmas festivity period, and how you plan for that effectively in time to start the 4th of January. And in some respects, that would then potentially encroach on your weekend, probably, because you would need to pick up all of the notifications of positive cases and self-isolation ahead of being in school on the 4th of January, so that you're prepared for that day. So the other consideration is whether we also look at the 4th of January being a remote education day. It would not be a non-pupil day as per se, we'd have to keep it as a school day, but whether it would be a remote education day. Now, if we did that in Essex, we would probably be pushing the boundaries of the Department for Education's guidance, but you know me, I'm not overly fazed by that. If you would also deem that to be something that would help, given the fact that I'm also very conscious that if you are going into the Monday, the Tuesday, hopefully not the Wednesday, but potentially the Monday, the Tuesday, that you know then you've got a clear week and a half of leave and break, because actually you can start your preparation on the 4th of January. The consequence of that with the DfE guidance is obviously you're then having technically two non-pupil days, children being at home for both the 18th and the 4th of January. So it's how would your parents feel about that in terms of the communication. So that's really what I would like to perhaps get a temperature check about, whether you would welcome that or whether you feel that that would cause more problems. It would be absolutely up to you whether you decided to go to do that. That's your decision. But whether we issue guidance about making that decision, I suppose, is the question I'm asking.
So Claire, should we pick up a couple of the immediate questions on that have come into the chat? So a couple of schools saying they had intended to set up an online form that their parents could use to make them aware if their children had displayed any symptoms. So something to think about is if they haven't received notification by the end of Monday that any child has started to have symptoms, would that be enough to stop checking the emails? Because by that time, there wouldn't be any school-based contacts, given that we contact trace for 2 days prior to symptoms. So if they haven't displayed any symptoms by the close of play Monday, there's unlikely to be any contact tracing needed.
Yeah, the only issue I can see with that, Alex, is for asymptomatic children who might get a test because another member of the family is tested positive or something like that, and then test positive.
Yeah, I think that's one we could take away and have a conversation with the contact tracing team about, because with an asymptomatic person, we would take the date of their test. And if they'd had that test result by Monday, there would be contact. If it was later than Monday, it may not be. So I think that's probably one that needs a bit more thinking through.
Okay.
So there was a couple of questions on that. If parents inform the office email of symptoms, do we need to pay office staff to monitor this? That might be a question for Nikki, mightn't it, on the HR side?
It does in the reading in the small print mention leadership, involvement of leadership. It doesn't really mention anything about office or support staff. And again,
sure,
so that's a query, because I mean, don't get me wrong, I'm not enthusiastic about this, and I am very concerned just for my own well-being. I'm sure we all are, and mental health, and my other leadership people. But I think if the onus is going to fall on some members of staff, and really maybe the leadership team would be the first port of call, rather than support staff that don't actually don't get paid for it.
Okay.
We can ask the question, Amanda, but I think this is aimed at leadership, not support staff. But obviously, if things are going into your office inbox as well, you know, that just you can manage that. You know how to do that more than capably. But yeah, and obviously, as you know, the ability to claim for additional costs is quite restrictive, as you know. So if you were looking to increase your office staff time, yes, you know, you would incur additional costs for that, really. But I think, I mean, I'm aware that the majority of contact tracing is done at leadership level, Amanda.
One of the bits of the guidance, just reading this, and this is not terribly helpful, but I think it's worth just people taking on board, is that the expectation is that schools, and for schools I'm afraid it does mean school leaders, are not asked to be on call at all time. Staff responsible for contact tracing may designate a limited period in the day to receive notifications. So I guess that as long as you're checking those emails, then within a time frame, then that's presumably sufficient.
Yes, yeah.
I mean, I don't think the DfE have really thought this through. They just want to keep that contact tracing working. So
they're trying to sugarcoat the message, I think, aren't they, a little bit, to be honest with you, forgive my cynicism there. So obviously what we'll need to do is that we'll need some communication with the contact tracing team as well. So Alex and I'll take that away. Yes, I mean, it's basically making it manageable for yourselves. The only slight concern I have about that is you could dutifully check your inbox, I don't know, between 9 and 11 one morning, and there could be 1 in there or 0 in there, and then the next day you could dutifully check it and you could have 3 or 4 or 5. So that's the challenge of that. But I can see how it is, and that would take your next day, to be honest with you, but I can see how it would minimize the need to be on call as such, in terms of having a phone near you for a set period of time. I'm not entirely sure off the top of my head, so forgive me, I'm not entirely sure how the contact tracing team would then work with that, because I'm not sure they would know what your hours of availability are, given the fact that we've got 550 schools in Essex. So let's talk to the team about that, Alex, to see if there's a way around that. Okay.
So carrying on down the list of questions, there's 2 comments that are very similar. So Matt and Jackie have both said that they feel it's too late to change the plans around dates, term dates, so the 18th and the 4th. So Matt has said it's too late to change plans on the 18th. Do have a non-pupil day already on the 4th, but could they consider the 5th as a remote learning day to give breathing space?
It's just juggling what we just said, isn't it, really? If you've already got a non-pupil day in the diary, it's just giving you, what we're trying to say is giving you that day to get all of the organisation that you need. You know, given you may be dealing with quite a lot of notifications, potentially giving your staff what they need just to settle back into term as calmly as possible. What I don't want to do is in any way create an expectation that again the your admin inboxes would need to be monitored over that weekend before the schools go back, because that really is restricting the break that you have, and it is very important that you take as much of a break and your senior leaders take as much of a break as you possibly can. That's what we're trying to support. So if the 5th is helpful in that, I'm very flexible to that. I think it's up to schools to decide what they do with it. It's the local authority sort of saying consider this, and if you want to do it, then it would have our support, really.
Okay. There's a couple of questions on there about sharing contact details with the Essex contact tracing team. So there is something we need to do about making sure we've got everyone's correct contact details, emergency contact details. I think how it works at the moment is probably how it would work going forward. So you would be notified by family of a positive test, and then you would contact the Essex test and trace team if you needed advice, rather than them contacting you. but we can do a kind of reminder of all of that in the comms when we share any guidance. A couple more comments on there about the 4th being a better idea than the 18th, because parents will obviously already made plans for childcare. I've heard of school authorising parents taking next week out if they need to quarantine. Is this acceptable?
So we are aware that is happening. No, it is not acceptable, and we will reiterate our advice that we sent last week, which is we do expect schools to be open now until the 17th, if that's what you want, with the 18th being a non-pupil day, or the 18th. With regard to that, we are expecting attendance levels, particularly in secondary, I'd have to admit, but we are expecting attendance levels to drop. There will be families that will take the decision to consider not sending their children in, so that they are minimising the risk if they are spending time with vulnerable relatives during the Christmas break. But that is something at the moment that the DfE does not sanction, and it's not something I don't think the local authority could support with regard to that. Obviously, I think what I said in my communications last week to you all is that we are aware that parents might choose to do that anyway. That is, a decision that they will be taking. We can understand the reasons for taking that decision, and you may want to consider you would not authorise the absence, but I wouldn't be expecting there to be any consequence of that unless it was a family you already had attendance issues with. And you may want to consider whether you do make available a home learning, home education offer, but again, there is no need for you to do that, so it would depend on what is going on around levels of attendance. But the likelihood is that levels of attendance will drop next week, because some parents will be taking that decision on behalf of their family time together their family time together over the Christmas break.
Claire, can I just jump in here? I know we've got 129 people online and they don't need to hear me eulogise on a soapbox, but this is a case of the DfE throwing out a date saying, oh, put a non-pupil day in because we don't have to then publish that we're expecting school leaders to work to Christmas Eve if you don't do that. And we also want you to make up the time because we're telling you can do this, but you can't actually lose any time on it. And frankly, it just stinks, doesn't it, from the DfE at this point, to stab school leaders in the back and basically ruin them after they've spent, since February this year, giving absolutely everything they possibly can to their entire school community to make sure they keep services running, to then come out with this on, what are we, the 8th, so 10 days before we actually finish for schools, without any idea of the pressure that schools are under from their staff and from families who, from the 11th know that if there's a positive COVID case, they will be isolating over Christmas. I just think, I know you work tirelessly for us and going back to the DfE, but certainly from the North East chair of EPHA, and I will speak on behalf of all the schools in the North East here and say, this is absolutely pants. And the DfE really, really need to hear that message very loud and clear. I mean, obviously you're digesting this now, and you and Alex and the comms team will go back and decide what you want to do on the 4th and whether or not that will make a difference. But basically this is saying I can't switch off as a head until, and I may actually have an electronic response with my staff on Christmas Eve to say, sorry everybody, ruining your Christmas, you've got to stay in. And I think it's just awful of the department and cabinet, and I would really be grateful, because I know you do a great job, for you to go back and say, I've got at least 103 schools in the county who are saying this is really, really bad news.
And Nick, I think you're speaking on behalf of all heads in Essex, because I think we all totally agree with that. Well said.
So I'm very happy, thank you Harriet, thank you Nick. I'm very happy to obviously share that with the DfE. I have no issue with that. I think it would be really powerful. Harriet, if on behalf of the Primary Heads Association, you might want to email Sue Baldwin directly and copy me in.
Claire, I'm really happy for Pam to cut a section of video and email the video to her.
not got an issue with that.
I'll certainly contact Sue Baldwin and also our RSC contacts as well. I think it's, none of us can, this is so unacceptable, making these decisions so close to the end of term. It's appalling. They just don't understand what's going on in schools at all.
Fine. Well said, Nick. Okay. And it's also, one of the reasons why I'm also thinking about the 4th for you all, because otherwise, you don't have any breathing space on that day, if that's something that would work for you as well, just to recognise the impact on all of you with regard to that. Right, okay, I think that's captured everything. There are some questions in there that we can pick up. There are some questions, Alex, particularly around the contact test and trace team. So we probably just need to put that in the guidance, the advice and guidance. It may take us a little bit of time in the morning to get all of that sorted out. So please do just bear with us. We'll send something out tomorrow. And then just having a looking at Claire's question. So what action should we take when we have evidence that children in bubbles that have had to close are playing out on the streets with children from other schools, presumably from also closed bubbles, when they're supposed to be self-isolating, and when we have contact with parents, they just say, well, they haven't got COVID, so they can do what they want. Advice welcome. Yes, we'll send that out. The advice is to contact the local environmental health protection team in the first, I would suggest. And talk to them about it. I mean, at the end of the day, Claire, I've said this before, you can only do what you can do. And we are aware of breaches of the restrictions. And you as head teachers, you can't have oversight of everything. And when you have clearly sent pupils home following the guidance to self-isolate as per the advice that you've received, if the parents then if a child is sent, if anybody is sent home to self-isolate, it is a legal duty to do so under the Coronavirus Act. So technically there is breaking the law, and the enforcement of the £1,000 fine could come in. Now, nobody's suggesting that would be enforced, but that technically is what is happening when the guidance is breached. And don't forget, in Essex we are tier 2, and so technically the rule of 6 is allowed outside. There is no double household mixing inside. So it would be coming under those restrictions in terms of Essex now being in tier 2 following the ending of the lockdown last week. And then finally, if you have an inset day on the 4th, can we still have an inset on the 18th, or will one of them need to be remote learning? One of them will need to be remote learning unless you take an inset from later on in the year. There can still only be 5 inset days. So if you're swapping your inset days around, then you would need to then have a remote education day, because particularly for those of you who are community schools, but also if you're academies, you would need to consult on this. You are technically adjusting the term dates. Basically, if you were to add another inset day or move things about, you're technically adjusting the term dates, which would need a period of consultation. And if you're a community school, that would need to come from the local authority, which is why it's much easier to do it if it's a remote education day, because then it would still count as one of the 195 school days, including your 5 inset days with regard to that. Okay. We're moving on to the questions anyway, so I think what I'll do is I'll bring Mike in. Mike can just give a little update if that's all right, Mike, and then we'll sort of go through the questions. And Pam, this session is scheduled to end at 4:30. Is that right?
Well, it was billed at 4, but obviously if you've got more time, that's wonderful. But
okay, well, I'll just make sure that we've got it hopefully about 10 minutes before the end, just to wrap up anything that came through ahead of that, really. So Mike, can I bring you in now? Is that all right?
Yeah, I mean, I will have to go about 4:15 because I've got to drive down to Basildon this afternoon. So yeah, so just very briefly in terms of an overview of where we are with Essex in the coronavirus outbreak. Sad to say things are not looking good across Essex generally. The impact of the 4-week national lockdown has been extraordinarily limited in Essex. I mean, really limited. In Basildon, rates are just listed on upwards regardless. In Harlow, we saw a big increase, which fortunately has leveled off now, and Harlow is now stabilised, but it's at quite a high rate, at a rate of about 200. Brentwood was high and started to go down, but sadly Brentwood's now turned. Brentwood is now increasing again, so the rates in Brentwood are as high as they've ever been, so we'll be around 275 by the end of the week. Similarly, Epping's rates are increasing. Even places like Chelmsford that have been quite low have got a bit of an increase as well, up to about 130 odd. Colchester is generally doing quite well, but it's slipping up a little bit. Braintree is struggling to get down, but again, Braintree is in the low hundreds. Tendering's brilliant. Tendering is bumping along about 70. Yeah, well done. Yeah, Tendering's doing really well. Uttlesford was doing quite badly, but Uttlesford's now gone down, and Uttlesford's performing well as well. Malden had been doing very well, but it's gone up. I think that might just be a small outbreak because Malden's quite small, and I think that might be reversible quite quickly. Castle Point has remained high, but it seems to be dropping, but nothing like as quick as I would want. Rochford sadly seems to be going up a little bit. But at the moment, clearly Basildon is hugely concerning because Basildon will have rates into the 400s imminently. And Basildon will be the highest places in the country, literally the top 5 in the country, very, very shortly. So this is partly because lots of other areas are seeing big decreases. So places in the north, most places elsewhere are seeing big decreases in cases, which means the Essex ones stand out even more. So other than parts of North London, North East London in particular, so Haverings, Redbridge, Barking, Dagenham, Kent, and parts of Essex, everywhere else in the country seems to have been seeing big declines. So we are not. So why it's so different in Essex than everywhere else, I just can't, except for North London and Kent, I really can't understand. So broadly, that's where we are at the moment. And in some areas it is very school driven, more I think secondary school than primary school, but certainly what we've seen in Basildon seems to be very strongly associated with schools. So up to about 40% of cases in Basildon are associated with schools one way or another, either teachers or pupils. We've seen a big increase in Chelmsford recently, and a lot of the increase in Chelmsford again is in that 10 to 19 group. And that's not the only place where we've seen that sort of increase. So overall, we've seen a 3 times increase in the rate across Essex in the 0 to 17-year-olds. And actually barely any increase in any of the other age groups. So a lot of this is being driven or manifesting in increased case rates in the 0 to 17-year-olds. I'll pause, take questions.
Mike, there's one question in the chat about, are we likely to go into tier 3 in Essex?
So this will be a central decision, and it is to be played for. The position at the moment is that we in Essex do not want to go into tier 3, absolutely not. That I think it'll depend on what happens in London to an extent. There's absolutely no question that Basildon ticks all the boxes to go into tier 3. Absolutely all the points. The Brentwood is getting there, but in terms of the direction of travel, Brentwood's getting there. Other places, less so, but they will be very, very influenced by what's happening in Basildon, and particularly what's happening in Basildon Hospital. And Basildon Hospital has been under some pressures recently. So it is difficult to be sure, but at the moment, it may well be that much of Essex, if not all of Essex, might end up in tier 3, although we as a county would not like that to happen and are looking to work with MPs on what the right solution is. Because places like Tendring, I mean, Tendring has got much lower rates. At the moment, there's quite a lot of activity in the Essex, the Suffolk, East Suffolk and North East Foundation Trust Hospital in Colchester and Ipswich, but all the difficulties are in Ipswich, not in Colchester. Colchester, the rates and the admissions for COVID have dropped off considerably. So places like Uttlesford, Colchester, Tendring, definitely. There's no reason that they should be in anything other than tier 2. Absolutely no reason at all. But we have to wait and see whether the government wants to move Essex as a unit or not.
So, Mike, at risk of asking a political question, do you feel from a medical point of view that actually it would have been a good plan for schools to have closed to pupils and offer remote learning for the last week? How much do you think the transmission of COVID is actually taking place in schools, and are we seeing a big difference between primary and secondary?
So I think we are seeing a difference between primary and secondary. I would say that if you look at the SAGE guidance and the SAGE recommendations, there is no question that closing schools leads to a drop in R value. Absolutely no question. So there would be an impact on reducing the R value. And I don't think anyone's denying there'll be that. I don't think that's a political question. I think it's a factual question. The difficulty then is, what about, as I've said, people just going out of school and going and mixing elsewhere, about children losing their education, about parents not being able to go to work. So it's not a simple sum. On the one side, yes, it reduced the R value sometimes, but there's quite a serious deficit side in terms of education, equalities, children going elsewhere. So lots of different. So it's a complicated question, but the simple answer is, in terms of R values, yes, likely it would.
Okay, and Mike, Matt, I'll come back to your question in a moment. But Mike, there's a question from Darren.
Yeah.
As it's requested tighter restrictions, will there be a request from ECC to go into tier 3?
So this is okay. This is my personal view, because I'm kind of responsible for this. When I recommended that Essex should go into tier 2 from tier 1, it was because it was quite apparent to me that tier 1 didn't work, and that Essex was seeing a very, very rapid growth in cases right the way across Essex. I mean, really rapid growth. It's doubling every so often. So we went into tier 2. We then went to a national lockdown. When that national lockdown finished, by the time it had finished, the government had realised tier 1 didn't work, which is what we said originally and why we went to tier 2, and they put everyone else into tier 2. We're in a position now where across large parts of Essex, we are not seeing big increases in cases. In Basildon we are, and in Brentwood we're starting to. So I would see no merit whatsoever in most of Essex in being in tier 3 over tier 2, because actually there isn't a huge amount of difference, as far as I can see, between tier 3 and tier 2, particularly over Christmas, where there's going to be a big gap anyway, in terms of the likely impact on the R value. And yet there's particularly, again, around the Christmas period, there could be quite a serious impact in terms of businesses and those wider determinants. So I would not be requesting to my colleagues, to my politicians at Essex, that Essex should be in tier 3 at the moment. Quite the contrary, I would want as much as Essex as possible to remain in tier 2 where that is possible.
I think, Pam, just to finish on that point, from my perspective, as you know, we did look at that. Mike and I did look at that, switching to advice to remote education, which we know that the DfE would not approve anyway as a strategy. But the other massive consideration, which Mike has covered, particularly from the angle of primary schools, is the impact on your parents in terms of their ability to go to work. Many of you have got vulnerable and disadvantaged families that have already been adversely affected by the lockdown. There may have been families coming off furlough as a result of the jobs that they're doing as well. So we just felt that that the impact on the impact on your parents and the impact on the workforce would have been huge, and potentially could have caused a lot of criticism and a lot of complaint as a result of doing that as well. So it really was a juggling act of everything that Mike has just said and that we considered as well around that, really. So it is a very difficult one. I think most of us, you know, I think would agree in our heart of hearts that we need the children in the school for as many days as we possibly can. It's the right place for them to be as well. So I think we get all of that. Right. I'm going to go back up to Matt's question, and David's got one as well. Question around those of you on the borders of Basildon and having children with Basildon in them, and should you be doing anything different? So the simple answer to that is no. So the situation in Basildon.
Sorry, I'm sorry to interrupt. I'm just going to mute everyone. So can you unmute yourself, or just sorry.
And it's been going on for a while. She said.
Okay. All right.
Thank you, Pam. Thanks, Pam.
Sorry.
So basically, the first situations, we will work with each school on an individual basis, basically. And if you have got a high percentage of children testing positive, that's impacting on the number of pupils then asked to self-isolate, that's impacting on your viability as a school. We will work with you individually, irrespective of where you are in Essex. And so I can tell you, you know, we do also have some schools in the west of Essex and in the mid of Essex at the moment have got some issues going on. And some of you have had those issues and been through them yourselves with regard to that. We are looking at talking to the Basildon schools slightly differently because of the increase in the 10 to 19 age range, as Mike has said. And of course, when we say, you know, the obvious, really, you know, this when we say associated with schools, you know, every pupil between 5 and 16 is in schools, basically, and then staff are in schools. So that's the impact on schools in terms of the age range. So we're looking at the age range in Basildon a little bit more. But if as a result of the community infection rates in Basildon, it is destabilising you as a school individually on the borders, then we will respond to you on an individual basis the way we would respond to any school around that. So I hope that clarifies the situation with regard to Basildon. So, and then yes, just to confirm, it is all Basildon Borough schools. It's not just the Basildon town. It's actually Wickford and Billericay are as impacted as the borough. So we've invited the secondary heads in Basildon to a meeting tomorrow morning, and we've invited the primary heads to Basildon to a meeting. Primary heads of Basildon to a meeting on Thursday morning. So if you haven't picked that up, that should be with you and in your inboxes.
Yeah, could we ask Mike some of the vaccine and COVID test questions that we've received?
Yes.
So there's a question that we haven't answered about whether Essex are now making decisions to close a bubble.
Oh, sorry. Yeah. Do you want to jump to that one, Claire? Sorry, that was...
The answer is no.
From
No.
David.
No, we're not, David. But again, this might be some of the noise coming out of Basildon that's confusing things, really. So no, we're not making decisions over bubbles. What we have, well, Mike and his team, to be honest with you, again, in a very short time limited period of sorry, it's been a long week. It's only Tuesday afternoon. A short time limited action we've taken is to now, if there is a positive test in a Basildon school, we're looking to self-isolate the bubble, and so we're not doing the granular contact tracing. Again, in every other part of Essex, we would continue with the granular contact tracing, and the schools will be involved in that, and therefore it is your decision about what happens and what goes forward. As soon as we can, we will ease that in Basildon as well, as soon as we can. So again, if there's noise coming out of Basildon, at the moment, if it's Basildon specific, it is Basildon Borough and the schools in the borough. We're not asking anything of any other school outside, even if you've got Basildon children and so on and so forth. And that's why we're having the dialogue directly with Basildon schools themselves. So if we're not talking to you specifically about that, it means it doesn't impact on you directly.
If I could just say this, Claire, I know it's a private matter with our school, it may relate to others. Essex Test and Trace told us the decision would be made by Essex. We waited all day for that decision. even though the same data with the upper sixth last week, we took the decision to close down on health grounds, not operational grounds. So there's a conflicting message coming out of test and trace.
That's helpful, David. I'll take that back. Thank you.
Okay.
Should we ask about vaccines and things? Obviously, we'll probably come back to some of the absence issues.
Yes, absolutely. Now, Dawn's question there. Mike, do you want to talk or Adrian about vaccines?
I'm not seeing any vaccine-related questions.
I might be confusing things, sorry. So about tests and so on. So I've had a couple of questions around, these aren't in the chat, these are questions that we were sent in advance, which I forwarded. So one is a lot of schools have been sent emails around the rapid antigen tests, so the SARS-CoV-2 antigen tests. Are these reliable and worth having in schools?
No, they're not worth having. No,
right.
No antigen tests. They're not. You need sorry, antigen antibody test, isn't it? Antigen?
No, this is antigen, easy to use, high accuracy, fast reaction COVID-19 rapid test, which claim to give the results in 15 minutes with 97% accuracy.
Well, nothing gives a 97% accuracy. If it's a lateral flow tests, then they're useful, but we can probably provide them anyway, can't we, Adrian, for free? If it's the antigen tests, they're not worth having.
Okay, I think it's two different things. We've also had questions around lateral flow as well, whether...
So they're all right.
And a question from a colleague around the lateral flow tests, whether they're the same as the current tests that just show up if you have the virus on that day. I'm not quite sure I understand the question, but it says...
So I think I did see this. It's one that it said that if you have a test, is it only show that you're negative on that day, and can you get it the next day? So the answer is yes, you can.
Yeah.
It's a snapshot. It doesn't mean that you're not incubating it. It doesn't mean that you can't get it means that on that particular time when you're tested, you test negative. It doesn't mean that you're not necessarily going to get it a day or so later.
Thank you. And so do we have an update on the lateral flow tests, Mike? Because obviously there was a discussion about lateral flow tests coming into Essex. Is that something that's going to happen?
Well, Adrian's probably best placed to talk about
that.
Okay. Simple answer
yes, thank you, Pam. So yes, we do have tests in Essex. What we're trying to do is to take an evidence-based approach to this. So we're not going to kind of wallpaper Essex with lateral flow tests. Neither are we going to ask that primary schools distribute lateral flow tests to all their parents and pupils and staff. Just really mindful of the fact that last thing we want to do is to kind of demonize schools as the route by which this is spread, because we don't think that's the case. What it is important to do, though, is to test children. So we will be doing that through community routes. The first one is gone live today in Basildon. A lot of work's gone into that, and that is, I think, pretty fully booked now up until Sunday. What we are trying to do is to take an evidence-based approach to this. So we will deploy as rapidly as we can a sort of pop-up testing site to high prevalence areas. Because what's really important is, even if there are hundreds of thousands of tests, although at the moment we only have 20,000, we haven't got quite as many as we were promised originally. What's important is that we are able to link every test deployed as directly as we can to some benefit in terms of coronavirus. I think the only other thing I would say is got to be really careful. A negative result around for a lateral flow test is not kind of carte blanche to go and then kind of behave irresponsibly. So we're going to be really careful about the messages. But we will be pushing that to communities, to children and parents through community routes, rather than making an ask of schools to do that.
Adrian, can I ask a question direct?
Sure.
Nick, head teacher of a primary school in Colchester and part of the Essex Primary Heads Association. Currently, At the point in a primary school, two form entry primary schools, we've got 60 children in our bubbles. We're a very tight site. So every time I get a positive case, I have to send 60 children home and any other close contacts, which could multiple numbers. So at one point, we were 184 children out and 22 members of staff. Actually, lateral flow testing, my understanding would be, is that I wouldn't necessarily have to isolate all those people for that period of time if I could lateral flow test over a 7-day period, of which I'm sure I could manage if I had enough, which children in education, I think, and therefore reduce the numbers of children out. So I would argue potentially, maybe against colleagues here, in saying, give me thousands of tests, I'll get the consent form from all the parents to lateral flow test their kids, because I would rather be able to do that and keep more children in school than be sending blocks of 60 or 80 people out at a time. So would you be able to give a bit of a response on that, Adrian?
So Nick, careful, I might well take you up on that offer, and thank you. So yes, I think there are various reasons about why you would use lateral flow tests, and it's really important to be clear about what those reasons are. So right here at the moment, and based on the public health evidence we've got, the best use for lateral flow tests is to break asymptomatic chains of infection and to go where there are high prevalence areas and absolutely hit it with everything we possibly can. This is an incredibly unpredictable virus, and sometimes it's a bit of a depressing place in public health.
So I'm just going to jump in to give you actual data, Adrian, from my school. So that out of the 5 cases that have been positive with children, 4 have been asymptomatic.
Okay.
So there is a lot of asymptomatic stuff going on in schools.
Yes, absolutely. So I'm just making the point, Nick, we need to be clear about why we're doing what we're doing. So we should be getting, we got a letter from Health Secretary about three weeks ago now that basically said we will get 140,000 tests a week, or 10 equal to 10% of our population in Essex. So far, we've had 20,000. We are aggressively pushing for more, and we're supposed to be having another 129,000 next week. I absolutely don't want number of tests to be a limiting factor to what we do. What we need to be clear about is why we are deploying tests in a particular way. So we need to do that on the basis of, what's the best possible impact. And I think prioritizing schools where you have very large bubbles and where there's potentially a lot greater impact, that would absolutely make sense to me. So it's trying to get the balance right between making it as available as we possibly can, but also deploying the tests in a way which are going to have the best overall benefit. And Clare, Alex and I have already discussed this. And in terms of the new year, then we will absolutely be looking at how we could use those tests in terms of ensuring, I guess, school business continuity.
Can I just say that at the moment, and I don't know if you answered this, Adrian, there is no strong convincing evidence that you can use it to reduce the isolation in the way that you self-isolation in the way you suggested. It is something that's been mooted, Nick. It's something that I know people are kicking around, and some people are saying 5 days, some people are saying 7 days, but it hasn't been tested yet. I think if that proves to be a correct methodology, then yes, I think all self-isolation everyone will be sent by the contact tracers 5 tests or 7 tests and asked to do one daily, and if they do it and they're okay, fine. But we're not at that place yet, so we're not in a position to share lateral flow tests with you as something to reduce time that people are in restrictions at the moment. But
thank you, Mike. That's an important distinction, and that's a useful prompt for me to say that this is a kind of particularly difficult one to do, because we're asked to kind of push out lateral flow, but actually the evidence on this is kind of changing. The national guidance changes on a daily basis. So I feel for you guys in terms of, potential changing guidance from DFE or whatever, I'm kind of living the same dream in many ways in terms of some of the changes that we're getting nationally on this. But, we have a plan in Essex. That plan may change, as it should, on the basis of emerging evidence and guidance, but I'm working very closely with Alex and Clare and have been for some months on this. So we will support you in a way which is, which reflects the evidence base and tries to ensure as much business continuity for schools as we possibly can.
Can I just, if that's okay, Adrian, as well, because I think there's a bit of confusion in some of the questions I'm seeing. So basically, there are 3 different sorts of tests at least. There are antibody tests. There are the lateral flow tests, which are rapid antigen tests, and there's the PCR, which is the kind of gold standard antigen test. So starting with the antibody test, the antibody tests tell you if you've been infected or not, and developed a response to that. They don't necessarily say if you're infectious or not, they are really of no value whatsoever in the sort of day-to-day stuff. So anything that's antibody tests at the moment, I just wouldn't bother with at all. In terms of the antigen tests, the PCR tests are the kind of the gold standard, and they work by multiplying the little bits of virus that may be around, so that even if you've got quite a low level of virus, they'll pick it up. So they're very, very sensitive. They're pretty specific, but they'll also identify dead virus. So they hang on quite a long time afterwards and could be positive for several weeks afterwards because of the way they work. The lateral flow tests are the newer tests, and they are also antigen tests, but they only work when you've got quite a high viral load. So if you were just developing the disease, or you had very early disease, they wouldn't pick it up. Or if you'd had the disease for a while, or your viral load is quite low, they may not pick it up. So they pick up probably, depending who does them, Adrian knows better than me, probably 50 to 80% of tests, but therefore of positives, therefore they miss some of the positives. However, they're the ones that we can offer at scale, and they're the ones that we are testing and feel are useful in certain circumstances. So antibody tests, don't worry about. PCR tests work. Lateral flow tests, there are values too, but they're not kind of a silver bullet for anything. But Adrian's working carefully on where they will add value and not, if that helps.
It does. Thanks, Mike. Mike, there was a question, I'm conscious that you probably need to go. There was a question earlier on about the modelling over the easing of the restrictions over the Christmas period. You might just want to give your opinion on what you think might happen after that.
Yeah, so I am sure there has been a lot of modelling, but it hasn't been very well publicised, or at least I haven't seen it. I think there's absolutely no question from anybody that if you meet with 3 families over Christmas, you are going to increase the rates of infection, and you're going to increase the rates of infection a fair amount. It could be quite problematic. So I think, will it have an impact? Yes, it will have an impact. How bad's the impact going to be? Well, to be honest, in Basildon, it can't get much bloody worse anyway, to be honest. But because there seems to be very little impact from what's happening anywhere. But I think that there's no question that it will be problematic. I think what's absolutely crucial, and it's for me to pick up the messages more widely, is that really from this weekend, people need to really start social distancing. People need to really start working from home where they possibly can. People need to do everything they possibly can to avoid exposure, because this is the time when they need to avoid exposure if they're not going to be infected over the Christmas period. So really, we've really got to get the messages now. If you want to see people over Christmas, if you want to be able to mix with your families, if you want to see your grandmother safely, it's down to you over the next fortnight to make sure you don't get infected or don't carry the virus. But it will impact.
Thank you. Thank you, Mike. I think the other 2 questions in the chat, one, Janet, I'll come on to in a moment, and there was one around the impact on lost learning and SATs. Janet, the answer to your question, I think we're expecting the new corridor announcements, travel corridor announcements on the 15th of December. I think that's the correct date. And therefore, if they do come through, then yes, it will change the self-isolation advice from the central government around the travel corridor, so people going to and from countries. So if your family are following that new advice, then my understanding is, unless Mike comes in and quickly corrects me, that if you have a negative test after the required 5 days, then yes, they can return, because it's linked to the travel corridor advice and not being a contact as such, and therefore requiring to self-isolate because you're a contact. It's a self-isolation requirement because you've travelled, and therefore the government are looking to change that as of the 15th of December. Okay. So are there any other questions for Mike or Adrian before we just go back to the SATs one? Mary, does a child coming from a tier 3
No.
Any cards today? No. Okay,
No.
that's fairly straightforward.
The rates in tier 3 areas aren't that high. To be honest, it may well be if we don't play our cards right, the tendering will be a tier 3 area in a while. I mean, it's not very high at all. In a population basis, it's only if you're actually, exposed and a clear contact. So that isn't the problem.
Okay, great. Thank you very much for that, Mike. Damien, you've just asked about decisions around, no, you don't need to wait for Thursday around the decisions around the 18th or the 4th of January. We're just giving you an update on the situation in Basildon and keeping the communications open, Damien. So we will issue guidance tomorrow, but you're quite within your, able to make those decisions. So please do proceed with those if that's what you want to do following the DF that came through this afternoon. And then there was one around the SATs and the impact of lost learning. So yes, we do need to recognise that, and everybody does. And I think that will be a key feature, especially given what Mike's just said around we don't really understand what the impact of the easing of the restrictions over the Christmas period will be in times of January, February, and the impact of that on the spring term, vis-a-vis how we use lateral flow tests more effectively as well, that is coming through. Obviously, you've seen the advice that came out from the government around the contingencies to the examination and assessment next year. And I've literally just reminded myself, so I've got the primary ones here. Ultimately, SATs are going ahead, except in GPS and science teacher assessment at Key Stage 2. There is going to be an extra week for both the Key Stage 2 tests and the phonics check in the advice as well. What you don't get in the primary assessments is whether there will be any relaxing of the grade boundaries per se, in terms of expected standard and meeting expected standard. That's not clear in there. So I will follow that up with the DfE about that. That's obviously a lot clearer in the GCSE and A-level contingencies that were put in place. But I would have thought that there would have been some in there to make sense, I think, really, in terms of continuing with the assessments, really. But we can follow that up nearer the time. Okay, Alex, are there any questions we've missed, or Pam?
No, I can't see anything we've missed, and anything else that I had on my list was covered by our conversation about the newly released DfE guidance.
Okay, great, thank you.
Could I just jump in with a comment sent to me by a head teacher earlier? It's just back to our occasionally thorny issue of contradictory guidance being given to schools. So parents sent a screenshot from NHS tracing saying that her child had been in direct contact with a person with COVID. This contact was on 6th of December. The text said the child had to be isolated until 15th of December. We only allow pupils back after 14 days as instructed, but this text indicated 10 days. Why is this conflicting guidance? So it sounds to me that it is conflicting guidance, and just another reminder, really, that we all need to be following the same guidance.
Yeah, no.
So Pam, that one was sent to me as well, and I have picked it up with the Essex team to see what their guidance would be. Yeah. And they've come back and said, without seeing the message, it's difficult. So I can't remember which school it came from, apologies. But if we've got a copy of the screenshot and you could send it over, we'll pick it up. But they have said, as far as I know, the notifications don't tell you when you had the contact with the positive case, just what your isolation period is. So it might have been that it was longer ago than they think it was, and that it might be a 14-day period that's been calculated for them, but we're not sure. So if you've got any further information, just send it over and we'll have a look into it.
Okay, thank you.
It was, can I just say it was me? It's my
absolutely.
Yeah, and it was, I have got the screenshot if you want it. And the parent contacted me and said they saw the person on Saturday, the 6th of December, and the screenshot says they can come back to school after the 15th. So she sent me a letter to say my child will be back on the 16th, and I said, no, your child won't be back on the 16th. So we had a bit of a, email conversation about that. So, because I'm just following obviously what I'm being told, it's 14 days. So I don't understand what the confusion, that's why there's the confusion, but I can send it to you.
That'd be great. Thank you, Sue. Send that across.
Okay. Just to the communications team, is it? Do I send it?
Yes, please.
Yes. Okay.
Yeah, thanks, Sue. Ronnie, yes, you asked about attendance. Apologies, Ronnie. Following on from your question last week, no, we haven't yet had a reply to that one. So leave that one with me, Ronnie, and I'll make sure we follow that up urgently for you. And I'll certainly make sure I've got a response if you're able to join us on Thursday morning.
Yeah, I will do. No, thanks for that. It's just I think there'll be quite a lot next week, and I've already this week seen a massive dip.
Okay,
just this week. So
yeah, we'll get some advice to you, Ronnie. I've got it on my list. So leave that with us.
Thanks.
You're welcome. Okay.
Yeah, just one question, I suppose, or obviously it seems like head teachers and the contact tracing team are all going to be busy during the Christmas period. But can you just if you know yet, what support will there be from the local authority during the closure period, so that if people have these kind of questions, obviously we'll be around, or I'll be around, but obviously we want to know who, if anyone from school comms will be around.
Yeah, sure. We're working that through at the moment, Pam. So we will make sure that that is sent out very, very, very clearly early next week. So everybody will have that early next week. So leave that with us in terms of that support. Okay, we've taken a few extra minutes. But thank you very much indeed. I think for many of you, but not all of you, this might be the last time I see you before the end of term. So I just want to again say, thank you so much. You are doing such a really amazing job in exceedingly challenging circumstances, and your ability to keep going and deal with all of that is absolutely amazing. So you have done fantastic to get to this far in the autumn term, which is always a difficult and long term at the best of times. And as I say, the end is almost in sight in terms of the decisions that you want to make. So thank you. As always, I will put that obviously through in our comms as well, but whilst I've got you in front of me, I know that you're all working tirelessly for your staff, your children, and your young people and your communities. And I'm sure everybody is very grateful. We will try and give you as much support as we can over the Christmas break. I want you to all have as much of a break as you possibly can over the Christmas break, because we will need to come back in January, and there will be further challenges to face, because good news about the vaccine and more testing, yes, that is really good, but it will not be in place quickly enough, I think, in terms of still being open with coronavirus in the spring term as well. So it is important that we all take a break. But a very, very, very heartfelt thank you and well done from me. Mike, I'm sure you echo that as well.
Thank you. Yes, thank you.
Okay, thank you, Pam.
Thanks, Claire. I'm going to stop recording.